most of the patients, whether it's ulcerative colitis or Crohn's disease, they have an overlap of few symptoms like diarrhea. They can have stool number of times per day, 5 to 10 times per day. They can have motions which are loose stools, or you can call it as semi-solid stools with mucus, with pus, with blood or without blood. Most of the patients who have ulcerative colitis will have blood in the stool, whereas Crohn's disease, it's rare to have blood in the stool. Patient may have abdominal pain, tenesmus, we call it as crampy abdominal pain while passing stool. They can have weight loss, night sweats, fever. They can also have a loss of appetite. Patient may have a failure of growth retardation if it is involving pediatric population. Patients with inflammatory bowel disease can present sometimes with complications with severe abdominal pain, distension of abdomen, perforation, with obstruction in Crohn's disease, or fistula formation with pus discharge from different sides. Sometimes patient can present with massive bleeding in a state of shock. So overall, if you try to look at the different symptoms with which the patient come, there are intestinal presentations, there are extra-intestinal presentations. So the patients who have inflammatory bowel disease, if you split into two, one is ulcerative colitis. The presentation is usually increased frequency of stools 6 to 8 times per day with blood or with mucus and pus, abdominal pain. Sometimes this patient can have weakness, fatigue, and then can have a weight loss. Some patients can present bloody diarrhea, and the patients who have a Crohn's disease, they can present with little different symptoms, like they can have abdominal pain as presentation symptom, distension of abdomen, night sweats, fever, again increased frequency of loose stools but without blood most of the times. The patients who are having Crohn's disease, they can present with a complication as I mentioned earlier, which are fistula formation, which are obstruction, and sometimes they can present because of the stricture obstruction. The patient can have vomiting and then distension of abdomen. Whereas the inflammatory bowel disease not only involves the intestine, it can involve other organ like liver. So they can have a primary sclerosing cholangitis. So they can also have hepatitis. They can also develop arthritis, eye infection or eye involvement in the form of uveitis, episcleritis, and joint involvement in the form of association with ankylosing spondylitis, HLA-B27 positivity. So a patient who has an inflammatory bowel disease can involve intestine, can involve other organs like extra-intestinal organs like bones, joints, eye, liver, and sometimes pancreas. So a patient presented to you in the OPD can be because of any of these. They can have a fistula, which is perianal fistula, fistula in ano, and can present to a doctor with symptoms of pus discharge, perianal area, pain in perianal area, or blood and mucus in that area, and may not have any other symptoms for that matter. So patient who has inflammatory bowel disease can present to a doctor with intestinal complaint, with extra-intestinal complaints, or complications of the existing inflammatory bowel disease, which can be catastrophic sometimes.